Welcome back to Africa 54. Lino Mudu is away on assignment. But in today's health segment, the world is winning the war against malaria, but it's a race against time. VOA's Pearson reports on the gains that have saved millions of lives and on the developments that threaten to set back the efforts to control or even eradicate the disease.
Malaria deaths have been cut by nearly 50% worldwide, and by even more in sub-Saharan Africa, according to the World Health Organization. An estimated 4 million lives have been saved, most of them babies and young children in Africa. This is largely due to a huge increase in funding over the past 10 years. The biggest boost came when then-President George W. Bush launched the President's Malaria Initiative. It provided millions of dollars for bed nets and drugs, and it helped local health workers learn how to diagnose and treat malaria patients. Rapid diagnostic testing has also made a difference. The Rollback Malaria Partnership coordinates the international anti-malaria effort. Dr. Fatoumata Nafo Traore heads the partnership.
In any single village, you can use the tests and know the result in 10-15 minutes, be able to give treatment to really any person suffering from malaria.
President Obama has refunded the program for 6 more years, with goals to cut the number of deaths by 1/3 and to eradicate the disease by 2050.
But still, we're short of 50% of the resources required for the global fight against malaria.
In addition, 2 things are happening that threaten the gains that have been made so far. In Africa, mosquitoes are developing resistance to the most commonly used insecticide. There are others, but they cost more. In Asia, the parasite is developing resistance to artemisinin, the main anti-malarial drug. Dr. William Moss from the Johns Hopkins Malaria Research Institute spoke to VOA by phone from Lubumbashi. He says countries need to work together.
If it's not all done together, the success and gains in a particular country can be undermined by the importation of malaria from their neighbors.
As for the U.S. goals of further reducing the deaths from malaria and eradicating the disease by 2050, Dr. Moss says it's an achievable goal, but it's going to be increasingly challenged by both insecticide resistance in Africa and drug resistance in Asia, especially if drug resistance spreads to Africa. Pearson, VOA News, Washington.